Okay, so we finished all of our testing. We ruled out a lot of things and certainly ruled in specifically the hip. So your lumbar spine was good, the femoral nerves were good, but the hip was positive on a lot of the tests. So what you have is a hip impingement on the right side. You've lost a lot of range of motion in that hip. That can be restored. So that's the positive, great news. And then you won't feel that pain anymore. But the key to your entire case is that you need to be able to better load your left leg with this past history of your ACL and meniscectomy. So when you're playing soccer and hiking and doing all these active things that you, even biking by the way, that you are creating a symmetry between these two legs and not overloading that right hip.
One quick question before you tell me what to do at home. How did you determine that there's no arthritic component or mild arthritic component, or is that still up for grabs?
In the right hip specifically? Yeah. So in the right hip, it'll show up as a capsular pattern, so there'll be certain range of motion restrictions that will show. You have a little bit on both sides based on the limited internal rotation, but nothing I'm overly worried about in that hip. Also, there'd be a little bit more of a crepitus and deep pain within the hip itself, or possibly some groin pain, and that wasn't there today.
Okay. So what do I do at home?
Okay, so what I'm going to do is give you a list of things to start with. So in our phase 1 exercises for this approach, what we need to do is release that psoas or hip flexor, because that was really, really tight and tender. And then I'm going to give you some hip mobility exercises, especially with a band, that will really help actually stretch the joint itself and create some space in there.
Well, thank you, Carrie, for doing this. I have confidence that you're going to get me back on track.